The cardiac surgeon who replaces your heart valve knows that a dental infection can cause many complications. That's why they require a full dental exam before heart surgery. Now, if any infection is found, the surgery gets delayed until the dental infection is treated. Harmful bacteria from a pain-free dental infection can travel through your bloodstream, land on a new heart valve, and destroy it. If your infected mouth keeps you from having heart surgery, what's it doing to the rest of your body right now? Hi, I'm Dr. Chuck Reinertsen, founder of the Dental Medical Convergence. Now, some people still think the mouth-heart connection is alternative thinking. It's not. Heart valve surgeons don't debate this. They act on it. Let me show you exactly what they know, why it matters, and what you can do about it right now. Now, the heart condition they're worried about is called infective endocarditis. In plain English, it's a serious infection on the inside of the heart, usually on a valve. People die from it, and according to the American Heart Association, this infection most often starts with bacteria coming from your mouth. Now, cardiac surgeons tell their patients about the link between dental infections and heart surgery complications. Most other physicians don't include dental infections in their health discussions. So, most people remain uninformed about the mouth-body connection. So, what happens to most people? They often walk around with pain-free dental infections for months, years, even decades, completely unaware of any dental or medical problem. 90% of dental infections have no pain at all. So how would they know if they had a dental infection? Your mouth has over 700 species of bacteria living in it right now. Now, most are healthy, and we need them. Only about 20 species are harmful, and those are the ones the cardiac surgeons are worried about. And you should be too, because just like high blood pressure, diabetes, and the early stages of cancer, most dental infections have no pain and give you absolutely no warning. And if you don't need heart surgery, most cardiologists and other doctors don't ask about your dental health. They're not trained to. Now, the same kind of bacteria that keeps a heart surgeon from operating can get into your bloodstream and damage your health, including your heart. Most physicians and dentists don't include dental health as part of their medical evaluation and treatment plan. Has your physician ever asked you about your dental health? Now, until that changes, you have to be the one to take control of your own health. And if you have any cardiovascular risk factors, high blood pressure, diabetes, a family history, or a known valve issue, don't wait for someone else to connect the dots. Get a complete dental exam, including radiographs or x-rays, to make sure your mouth isn't the source of the bacteria causing your problems. You don't need a heart condition for harmful bacteria to get to your heart. You just need bacteria from a tooth or a gum infection, even if you have no pain and don't even realize you have an infection. But here's the good news. You can lower your overall risk by spending 8 to 10 minutes once a day thoroughly cleaning your teeth with a soft toothbrush, interproximal brushes, a water flosser, and dental floss. Now, use disclosing tablets once a week to begin with to find any spots you're missing. Then go back and clean those areas. This is where you learn what it really takes to thoroughly clean your teeth. It's important for you and your family. You'll all be healthier and save a lot of money too. Heart surgeons take the time to ask about your mouth before surgery because it's very important. You can take 10 minutes every day to make sure your mouth is infection-free. It's important too. Now, good home care prevents the next infection. Your dental exam finds the ones already there. Fix the dental problems, and then prevent any more. Prevention isn't exciting, but it saves time, money, and pain. And it saves lives too. It's well worth 10 minutes a day. Now, if you want to understand more of the hidden connections between your mouth and your health, check out my book, Are Your Teeth Making You Sick? is available on Amazon. And if you or someone you love has seen their medical health improve after addressing a dental issue, please share your story with us at stories@thedentalmedicalconvergence.org. Now, your story will help many others better understand that dental infections can have many different medical consequences. Let's connect the dots between the mouth and the rest of the body. Now, if this video changed the way you think about your dental health, please hit like, subscribe, and share. The sooner people understand the oral systemic connection, the quicker many people will be healthier. Thanks for sharing and helping. In the interest of your better dental and medical health, I'm Dr. Chuck Reinertsen. Thank you.